Good afternoon, everyone. This is Dr. Ray from Bradford Family Chiropractic. The reason I'm sending you this message right now is if you're dealing at home with some type of, we'll call it a chronic or consistent stiffness in the shoulder, we're going to maybe give you some home tips on how to take care of it. So first off, don't confuse this with true specific medical advice if you did some damage to your shoulder. If you fell down the stairs, if your dog Charlie pulled your shoulder out of the socket, give us a call, go to the urgent care, see your orthopedist, but don't necessarily follow these directions. These directions are more for, I'm having some stiffness in my shoulder and I'm noticing that my range of motion, the way my shoulder moves, isn't perfect. So how you think about this at home is our shoulder flexion going straight up in the air should be about 180 degrees without pain. If you're only getting about this distance, this conversation might be for you. This direction, we should also have 180 degrees. If you can only get it up about half the way with some discomfort, this video might be for you. So let's determine this is for you. We've had significant stiffness in the shoulder with a loss of range of motion. One of the most advisable things you can do is just to get what they call joint mobility. Mobilize the shoulder to the best of your ability. Now, had you gone to physical therapy for this, they actually have hand bicycles that you could work with. They have pulley devices, but unless you're like me and you have some of these devices at home, you're kind of stuck with the materials you have at home. So I'm going to show you one good quick way to mobilize your shoulder. And again, this is just getting the joint moving. They call it a Codman exercise. I tend to call it stirring the pot, and you'll see what I'm talking about in just a second. The main goal of this movement is just to kind of get circumduction, get the circles and the movement back in the shoulder. So how we're going to do this, we're going to use our involved arm and we're just going to let it dangle down. Now the first test is if it's very uncomfortable and it's painful in the shoulder, we shut it down and we don't do it. However, if this is very comfortable, I'm going to ask you to do this, and we're going to start with the easier one. And the easier one is internal rotation, moving the hands towards the body with varying circle sizes. So I'm going to ask you to do about 3 sets of rotations where we're kind of generating the movements from the body, not necessarily from the shoulder. And I call it stirring the pot. If you think about this as one big pot of sauce or soup, we're just moving it around and we're getting some large circles and we're getting some moderate and maybe some small circles about 30 times. Then we're going to go in the opposite direction. We're going to go more of an external rotation, and this one's going to tend to be a little less comfortable. And we're going to try to do this one again for about 30 rotations or 30 seconds of varying sizes. So this is called Codman exercises or stirring the pot. We want to do those circles 30 times in each direction, roughly 3 times a day. This should help mobilize the shoulder, break up restrictions, and improve the range of motion over time. Again, if this isn't helpful, if it's painful, stop what you're doing, give us a call at the office or call up your orthopedist. Thank you, and wish you all safe.